Boosting will clearly increase immunity and antibody response, and we think somewhere between 5 and 10-fold increase in antibody response with the booster. Generally, just to step back for a minute, boosters historically have been given for two reasons. One, boost the immune response, make people more protected. The other one that we don't hear as much about, but is probably as important, if not more important, is that often when we use a booster, there is a long-term or much longer duration of protection that occurs once someone gets the booster. After 2 months of getting the first J&J, you can get the second. And I would encourage anyone who had the J&J to get boosted after 2 months. Don't mess around, because the immunity tends to wane. It's probably not covering the Delta variant as well. And your immune system needs some kind of boost to increase your protection. The Pfizer and Moderna, the mRNA vaccines, the booster can be given after 6 months. Again, the reasoning behind that is it seems as if the immunity and protection starts to wane or lessen after 6 months. That's been more clearly understood, and I think we have fairly good data, a lot of it out of Israel, on the Pfizer vaccine, that it starts to lose its efficacy or its ability to protect after 6 months. So therefore, getting a booster 18 and older is prudent. Again, I'm not a huge fan of doing different mix and match combinations, but it's a style call more than there's a science call. And I think, again, it's up to the individual and the provider really to determine that. And then the Moderna, anytime after 6 months, that protection seems to be a little more longer lasting. We're likely to see other variants, other mutated viruses. That's the way viruses work. And so the thing that we can do is to try to boost our immune system as much as possible and as broadly as possible to respond to any variants now or in the future. So my argument with the booster is that the safety profile is excellent. We have reams of data with ongoing observational and surveillance data that is well beyond any vaccine that's ever been produced, distributed, and used. The benefit is to maximize immune response in as broad a fashion as possible, so that people in the future, if they are exposed to variants, hopefully will have some natural immunity, some immunologic response because of the vaccines and the boosters. So there will be more variants in the future, just about can guarantee it. And so what we can do is get the vaccines that are available and get the boosters that are available now. And if we need to get others in the future, those, at least with the mRNA vaccines, can be developed in a fairly timely fashion and hopefully manufactured in a timely fashion. Certainly anyone vaccinated has a much, and boosted for that matter, uh, it has a much lower likelihood of A, getting the virus, and B, likely transmitting the virus because viral loads are less. One of the things that I'm finding, and I think the other providers in our office are finding as well, is that people are getting a little less vigilant, a little less uh, concerned about uh, spreading something if they're sick. Again, this has to do with the fatigue. And I think, what's happening is now, I think, if someone's ill, they're not sure, is it COVID? Is it another viral illness? Is it my seasonal allergies? Is it my every early winter sinus infection? Is it the leftover food I ate 3 days ago? There's more variables. Testing is still very effective, especially if you've had your symptoms for more than 3 days. Most tests and home tests really as well are quite accurate and effective at looking at COVID. Again, if it's unclear, you're probably better to err on the side of caution and not go to work, not go to school if you have infectious symptoms. As a community and as a country, and really we've come a long way in our understanding, in our prevention strategies, and in our treatments for COVID. I mean, we are clearly not in the same place we were a year ago. We've made significant headway, and we've made considerable gains in both the understanding of what we're dealing with and the treatment and the treatment options. And there looks to be on the near horizon some at-home oral treatments for COVID that seem to be quite effective at preventing severe disease. So I would ask people to not be discouraged. And certainly I understand frustration, but also realize that we have made considerable gains at reducing the impact of this virus on ourselves individually, in our society as a whole.